Hi, we're going to talk about healthcare versus medical care and if you know the difference. I'm Suzanne Fasella, a physician assistant and owner of Patient Best. I have been frustrated with the healthcare system and what it has done to the medical care system. Some of you may know my story. My dad was an old country doctor, and I was doing house calls with him when I was 5 years old. And at 11 years old, I went to work in his office, which was in the front part of our home. My dad didn't have charts. I asked him once why he didn't have any, and he said, "What do I need them for? I know my patients. I know their families because I also treat them. Some of them he even delivered. And when they go to the hospital, I see them because I'm the one that put them in the hospital, so I round every morning at 5 o'clock. I know the medications that they're on. And don't forget," he said, "every weekend your mom and I are invited to weddings and funerals, bar mitzvahs, christenings, and confirmations, as well as graduations. So I always see how much they eat, drink, and smoke. So what do I need a chart for?" Well, long story short, my dad died, and we had to close his practice in 1979. His office visit was $4. There was one insurance company back then, they paid $2 of the $4. Well, I went off to college and started teaching high school for years. At age 50, I went back to school and got my physician assistant degree. My first job was in internal medicine, and I was shocked. 3 weeks into the job, I knew this was not the medicine my dad had practiced. I hadn't signed up for this. Medicine had changed so much, and no one knew who anybody was anymore. So I started teaching patients how to become better patients, get the right doctors, the right treatment, and the right outcomes, how to ask the right questions. Somewhere along the way, while I was teaching, healthcare became a for-profit business, while medicine was a non-profit profession. There's a huge difference between the two. Whereas the medical system has never been better, we have new procedures, we have new drugs, we have the capabilities of doing surgeries we could never do before. We have vaccinations, we have screening tests, we can prevent cancer. Medical care is better than it's ever been. Healthcare has gotten worse. When you think of healthcare, I want you to think about the long wait times. The doctors have to spend 5 minutes with you and no longer. The charts are always wrong. Your insurance premiums are higher. The denials are more. And there's so much government regulation. We don't know what we can and cannot have. It's a pretty tough statement, but I know it to be true because so many providers have said this and so many providers are burning out. And I'll give you an example of how this works. When you call your doctor's office and it's not involved with health care, you get, "Hi, oh, it's good to hear your voice. Yeah, come on in, Susie. We'd love to see you. The doctor and I were just talking about how you are and what you've been up to." If you have a health care system involved, it might be 2 or 3 days before you even get a call back from the doctor. And the call center may be in another state. And if you have to get in to see your doctor, it may be 3 or 4 months before they have the first appointment for you, even if you have the flu or urinary tract infection. So they tell you to go to the emergency room. That's the big difference. So why am I telling you all this? Because Patient Best was founded on reintroducing you to the medical system. We believe in clarity and transparency. Let's get back to medical care, not health care. As a provider, and hundreds of providers like me, we're going to remove the roadblocks. Everyone working in the doctor's office, the nurses, the CMAs, the CNAs, are just as frustrated as you are, and they're helping too. So we're going to show you how to get back to good old-fashioned medicine and medical practices. Some of us remember it back in the 60s and 70s. Good medicine is the physician knowing you and you knowing your physician. So don't ask for health care, ask for medical care. Please leave a question or comment below, and if you like what you hear, let us know, and be sure to subscribe to our channel so you can get the care that you and your loved ones deserve.